Hi, my name is Dr. Xingwei Liu, and I am the Medical Director for Texas Ketamine and Wellness Center. One of the most common questions I hear from patients is, how does ketamine actually work? And usually that question comes after someone has already tried a lot: medications, therapy, lifestyle changes. And despite doing everything that they were told that they could do, they're still struggling. When that happens, people often start blaming themselves. They assume that their brain is broken. I want to start by saying something very clearly. Your brain is not broken. What's happening is that your brain has adapted, often to stress, trauma, depression, anxiety, or chronic pain. And adaptation can be reversed. To understand how ketamine works, we need to talk about how the brain changes at all. This brings us to a concept of neuroplasticity. Neuroplasticity is the brain's ability to change its wiring in response to experience. It's how we learn, it's how we adapt, and it's how we heal. In depression, anxiety, and trauma, neuroplasticity becomes restricted. The brain gets stuck. Thoughts repeat. Emotional responses become automatic. Hope feels inaccessible. Ketamine works differently than traditional antidepressants because it targets a whole different system entirely. Most antidepressants work on monoamines, one neurotransmitter: serotonin, dopamine, norepinephrine, etc., etc. Those medications can help some people, but they tend to work slowly and only help a subset of patients. Ketamine does not work primarily through these neurotransmitters such as the monoamines. It works through the glutamate system, which is the brain's primary excitatory signaling system. At the center of this system is a receptor called the NMDA receptor. The NMDA receptor is one of the most important biological gates for neuroplasticity. Under normal conditions, it is mostly quiet. It activates only when neurons fire in an unusually strong or unusual patterns, the kind that signals the brain something important is happening, that we're learning. That's why NMDA receptor is often described as an AND gate. It requires both chemical signaling and electrical activity. This prevents the brain from changing too easily. Neuroplasticity is metabolically expensive. The brain only wants to change when it really needs to. Here's where ketamine creates what initially seems like a paradox. Ketamine is an NMDA receptor antagonist. It blocks the very receptor that we just talked about, which is associated with learning and plasticity. So how does this drug block the plasticity, somehow increase neuroplasticity? Well, the answer lies in which neuron ketamine blocks. So a little background: the brain is made up of two major types of neurons. There's an excitatory neuron, and then there's also the inhibitory neurons, which suppresses activity. In a healthy brain, these systems balance each other very well, almost like a checks and balance system. In depression, that balance is disrupted. Ketamine preferentially blocks the NMDA receptors on an inhibitory interneurons, so almost like a double negative. When those inhibitory neurons are suppressed, they stop restraining the excitatory neurons, and then the result is disinhibition. Excitatory neurons begin firing in a very powerful burst. These burst firing patterns are exactly the pattern that triggers neuroplastic changes. This burst activity leads to a rapid increase in glutamate signaling through AMPA receptors, and downstream of that cascade, something critically important happens. The brain releases BDNF, which is a brain-derived neurotrophic factor, fancy term. BDNF is one of the most important molecules for learning, memory, and recovery. It then activates what's called the TrkB receptors. It will help promote new synaptic connections. It strengthens existing circuits, and in animal models, ketamine does not work without BDNF. In humans with impaired BDNF signaling, ketamine is far less effective. This tells us that BDNF is not optional, it is central to change. Ketamine also appears to directly activate the TrkB receptors in a different pathway altogether, meaning it may mimic growth factor signaling itself. This helps explain why ketamine produces rapid neuroplasticity faster than traditional antidepressants, And importantly, ketamine works on multiple timescales at different pathways altogether. There are short-term effects such as dissociation, altered perception, mild euphoria. These happen within minutes to hours. There are medium-term effects such as relief from depression, suicidality over days, and then there are long-term effects, the actual circuit rewiring that we talked about, which sometimes can last for weeks and even months. These longer-term effects require repeated dosing and integration, which is also part of the whole key concept behind all of this. With all of the different mechanisms of action of ketamine, the brain regains the ability to evaluate options, plan, and adapt. This is why ketamine is best understood as a catalyst, not a cure. It opens a window. What happens during that window matter. Behaviors matter, therapy matters, sleep, movement, light exposure, relationship, everything will matter during that time. Ketamine makes the brain more receptive. It does not do the work for you. If you ever felt trapped in a pattern that you couldn't escape, well, ketamine may help to restore that flexibility. Not by changing who you are, but by giving you and your brain the ability to change again. If you're considering ketamine therapy, the most important question isn't what does it feel like? It's how will I use the window that it opens? That's the conversation worth having. If you've stayed with me through this entire discussion, it tells me something important. It tells me that you're not just looking for a quick fix. You're trying to understand what is really happening in your brain and whether there's a path towards that so that it will make sense for you. Ketamine therapy is not right for everyone, but for the right person, in the right clinical setting, as well as the context, the right structure, with the correct support, it can be an extremely powerful tool. The most important step isn't deciding anything today. The most important step is having a real conversation. If you're curious of whether ketamine therapy might be appropriate for you, I invite you to schedule a free consultation with me at the Texas Ketamine Wellness Center, and we can talk about it together.